Ghana's dialysis crisis attracted parliamentary attention Thursday. In fact, there was a bipartisan call directed at the Korle-Bu Teaching Hospital to immediately reopen the outpatients department of its renal unit. Delivering a statement on the floor of the House, ranking member on the Health Committee described the hospital's closure of the facility as unconscionable. Parliamentary Affairs correspondent Korle-Bu Renal has more.
A frantic appeal to the Korle-Bu Teaching Hospital to reopen the OPD of its renal unit to save lives. Already, the Renal Patients Association says a dozen of their colleagues have died following their inability to access healthcare services. According to Minority Spokesperson on Health, Kwabena Minta Kando, government must intervene to get the facility reopened immediately.
Parliament as a whole should be deeply concerned about the persistent closure of the renal unit outpatient department at Korle-Bu Teaching Hospital. This situation has far-reaching implications for the well-being of dialysis patients in Ghana and raises serious questions about the commitment of government to transparency and accountability in our healthcare institutions. In the initial case of the facility's closure was attributed to scarcity of essential medical consumables required for dialysis. When dialysis medical consumables were finally procured, the service saw an unprecedented increase in fees from 380 Ghana cedis to 765.42. The Minister of Health and the hospital administration must, as a matter of priority, address this situation. The denial of essential healthcare services is a severe violation of patients' rights and a breach of public trust. We implore the government to work diligently with the hospital to rectify this situation and uphold its commitment to providing accessible and affordable healthcare service to all citizens. The paramount objective must be the prompt reopening of the renal unit outpatient department and the provision of essential subsidies to ensure that healthcare services are accessible and affordable for all citizens.
This call has found support from the majority leadership.
I fully associate myself with the call for the minister to be programmed to appear. That is something we cannot compromise on. He must appear. And especially in a matter about the lives of our citizenry, we can't take for granted. It can happen to any of us. And so I'm fully associated with that call. It's about the lives of our people. Whatever it takes, he must appear. We must program him to appear and to brief us. Immediately, the Korle-Bu Renal Unit should be opened immediately. And there are some other actions that have been taken. That is why I'm emphasizing the call. As we need you to bless this call, that the minister should be programmed to come and make this statement formally on the floor of Parliament. He can't sit in his ministry and engage the media and make this statement. He must come to the representative of the people and make this statement formally in the House.
The Speaker has since summoned Health Minister Korle-Bu Renal to appear before MPs on this urgent matter.
To come and brief us on the closure of the renal unit outpatient department and the upsurge of kidney-related problems in Ghana. I mean, the minister should come and tell us something. Almost everywhere, people are talking about the kidney-related problems. He should come and tell us if the NHIS issue can also be captured in relating to kidney-related issues. I mean, he should come and tell us and to the extent the whole nation. So that is my directives.
The Renal Patients Association says its members and other kidney patients are dying, and more will die if government does not impress upon the Korle-Bu Teaching Hospital to reopen the outpatient department of the renal unit of the hospital. This matter has become a big matter on the floor, and in a rare show of bipartisan unity, MPs on both sides have been asking the health minister to intervene and get this unit at the Korle-Bu Teaching Hospital open. MPs say that while citizens must do their best to protect themselves of kidney diseases, those who already have contracted such diseases must be protected by the state. Reporting for JoyNews, Korle-Bu Renal Parliament House, Accra.